Welcome to Hot Takes, a series from Red Hot Healthcare that delivers thought leadership to viewers and listeners in under 15 minutes. There's no softball questions or sales pitches on this show from any of our guests. And I'm your host, Steve Ambrose. Now, today's hot take is from me. And on today's show, I'm going to address a topic in healthcare which is, well, frankly, it's radioactive. I'm not going to mince words. This is a taboo topic, and I've been in healthcare for over 30 years, and rarely have I ever heard or seen healthcare leaders discussing it, especially in discussing meaningful solutions to improve it. Now, what am I talking about? Pricing and affordability in the U.S. health system. Look, guys, it's the elephant in the room, and there's no hiding it. Healthcare services, health insurance, and medications have become far too expensive for many Americans. Mass unaffordability has become an epidemic in healthcare. It's not just happening to the poor. The prices are too high for the majority of individuals and many companies to afford. Unaffordability for care services, medication, and coverage is a major vulnerability impacting care engagement, medication adherence, clinical outcomes, and population health. And so many conversations, solutions, and strategies today that we hear, we read, include social determinants of health, health equity, care access. Well, can we count on affordability as one of the top social determinants of health in America? Because unaffordability cuts across race, age, communities, and even between the insured and non-insured populations. Recent polling from the Kaiser Family Foundation found that 43% of adults reported that they or a family member in their household either postponed or put off needed health care due to cost. And a report from KFF estimates 41% of the American population, or 100 million adults, has debt related to health care. Since the Affordable Care Act passed in 2010, insurance premiums for families covered by employer-sponsored plans increased 47% to almost $22,000 a year. That's care coverage for people covered by employers. A recent Gallup poll even noted that 44% of respondents, that represent about 112 million Americans, give healthcare affordability a rating of a D or an F. Look, if we don't fix this major challenge, we're not going to get what we need in fixing health equity, care gaps, and clinical outcomes and population health. So the first question to ask about affordability or lack of affordability and pricing in healthcare, first question is, what's causing it? Because we can talk all day long and point fingers about, well, the fee-for-service model. We got to improve that. We got to make that value-based care. Okay, I'm in. And I think a lot of other people as well are in on that too. But how is that going to make the prices of care services and the prices of health insurance and medication, how's that going to lower those prices down to be more in line to what people can afford? Look, the last time I checked, when I looked engaging value in the purchases and decisions that I make in products and services outside of healthcare, of course I look for quality, but it also matches up with prices. And if we look at the total healthcare costs of the U.S. each year, is that not a function of quantity times price? Prices matter to affordability. And the thing is, they never seem to come down in a meaningful way. We need to take a strong look at systemic change that's based on changing how prices are set and influenced across different parts of healthcare. Let's start with drugs. According to Dr. Vivian Lee in her book, The Long Fix, many countries use QALY, or Quality Adjusted Life Year, to determine which drugs should be on their formularies and their pricing. In other words, determining drug cost effectiveness from drug testing and results, and then putting that into calculating drug prices really matters. But guess what? The U.S. government has been really resistant to this approach. So much so that, funny enough, the Affordable Care Act prohibits federal research agencies like PCORI, or the Patient-Centered Outcomes Research Institute, from even funding research and that would use cost by quality to evaluate new drug treatments and their prices. So tying price into effectiveness just isn't happening as much in the U.S. as it should be. And it's one of the reasons why U.S. drug prices are so much higher than the rest of the world. And then, of course, there's the business practices and the money flow of PBMs. And I'm not here to de-profitize the drug industry. But look, let's get real. Medication non-adherence is a $300 billion a year problem in the U.S. And one of the biggest reasons that people aren't filling their prescriptions and they're cutting their pills in half when they take them, it's affordability. And on care services, there should be greater focus placed on a small group from the American Medical Association that's existed since 1992. It's called RUC, or the RVS Update Committee. Now, RUC has a heavy influence on how Medicare and commercial payers really set their physician service reimbursement levels and prices. Finally, the medical loss ratio that's involved with insurers. Transparency around how prices are set is really going to matter when we look at handling mass unaffordability. Now, the next question is this. When we look at healthcare, is it too big to scale back? Now, notice I didn't say it's too big to fail. I didn't ask, is it too big to fail? But look, healthcare is the largest employer segment in the U.S., and we need to ask ourselves, what would happen if we made healthcare more affordable, if we cut back prices significantly to improve affordability? Would we see more doctors, nurses, and other health employees leaving? Would there be less professionals coming in? Does healthcare and its high prices really need to keep being propped up so that we can prevent a significant economic event from happening? A final question to consider is this. Will prices ever go lower in healthcare? Over the last few years, we've seen price transparency coming out. Price transparency has become a great big buzzword. And while the idea of improving transparency across provider, payer, pharma, and other health industry segments is a welcome one, how exactly would greater price transparency drive prices down, especially in a meaningful way? I mean, wouldn't price-setting mechanisms that are in healthcare today preclude that from happening? If we could talk about direct contracting between providers and self-insured employers, I think that's a very positive step. But let's take it one step further. With the transfer of high out-of-pocket costs now being shifted over and propped up more by the employees, are we going to also see out-of-pocket expenses and costs dropping? And that leads me to really another point. Healthcare leaders always seem to be talking about needing to reduce costs. And I get it. Costs are not a good thing. They also talk about chopping away 30% of healthcare spending that's related to fraud, waste, and abuse. And I would argue, again, that we need to look at prices, and pricing is a key driver of that total healthcare spend. But, okay, let's say we could find a way for payers and providers and pharma companies and other healthcare segments to just chop costs. Maybe it's AI. Maybe AI is going to come in and save the day, right? Now the question is this. The costs are chopped. Let's say 20% of costs are chopped. Would these organizations then return back those costs, or a significant portion of the saved costs, back to the American people in the form of lower prices to help mass unaffordability? Would they do that? Or would it go back to the benefit of the organizations? Let me bring this to a head and a close. I'm not someone who is for single-payer government care. And to me, profit is not a dirty word. But the fact is we have an epidemic of unaffordability in healthcare in the United States. As far as I can see, there's nothing today or on the horizon that's really coming to help. Now, I brought this topic to light because if we want to truly reach what we preach in healthcare, a significant change needs to happen in pricing and affordability. Because today, there's a lot of can kicking, there's a lot of finger pointing, and there's a lot of avoidance happening around this topic. And I get it. It's not easy. It's not a feel-good topic. It's not a feel-good issue that we can all win with. There's going to be pain in dealing with this. And we're at the point where leadership really needs to step in. And I don't suspect, again, that this type of meaningful change is going to be comfortable. So I've got a few questions. How are we going to address pricing and affordability to help people en masse with this significant challenge? Because for many, pricing and affordability is exactly what's keeping them from taking action and getting more engaged and responsible for their care. So who's going to step up? How will it happen? Will it happen? What happens if nothing happens? Think about that. And perhaps you're going to be the one to find a solution. Thanks for taking the time to listen to this episode of Hot Takes, a special series from the Red Hot Healthcare podcast. And if you're interested in being a guest on the Hot Takes show, just visit redhothealthcare.com and click on the Hot Takes navigation bar link. There's a form on the bottom of that page to fill out. All applicants are reviewed, considered, and some chosen. And you can subscribe to Hot Takes and get every show update by visiting the Red Hot Healthcare show on Apple, Spotify, and most podcast outlets. Thanks, and have a great rest of your day.